Okay, welcome to the last position, guys. In fact, this is what we needed to have started with. Indeed, we started with it. This was our first position, right? Do you remember that? Dorsal-recumbent position, supine position, facing the sun, right? Yes. So the term dorsal refers to the back, okay, or spine, and recumbent refers to lying or reclining, okay? So the lying, back, lying, okay? So in dorsal recumbent position, the patient is lying on their back, their knees flex, and their feet flat on the bed. So the knees are extended and directed upward and outward. The body is lying down with arms nearby. This position allows large range of motion without causing discomfort or pain, which makes it ideal for patients with limited mobility. This position allows nurses and other medical guys to examine the hips more easily. When a patient is placed in the dorsal recumbent position, their body will naturally align itself with gravity, and this helps to reduce swelling in the limbs and joints. What do you need to watch for? As an RN, you should take note of the discomfort the patient may be experiencing, especially in the abdominal area. Okay. In summary, guys, we are saying that for unconscious patient who do not who have not sustained trauma should be placed in the recovery position, and we have talked of that lateral recumbent position more so on the left. If a patient is on the floor or ground during an emergency, you may have to drag the patient away from the scene. Okay, remember I said you don't need to drag, but you see, in case of emergency, you can drag away from the scene instead of trying to lift or carry the person. Okay, thank you so much. And those are the different patient positioning that nurses use. Until next time, kindly enjoy the lecture on patient positioning and let's know your feedback. Thank you so much. Have a nice time.